what advice do you give adult children who want to support their aging parents while respecting their independence? And what triggers should they put in place that would then require care?
Just being able to talk about the issues sooner rather than later is going to be really important. Ignoring what's ahead of us is not going to solve any problems for you, and it's just going to set up a panic or crisis mode for everybody. So you don't need to necessarily talk about all the things all at once, but I would encourage people, even in their 40s or 50s, to talk to their parents about that well before it's time to discuss that. So talk about your living choices. Again, like where do you want to live? What does that look like? Really understand the cost difference between living at home or living somewhere else. Talk about the financial aspects of it, and who's going to help from a financial planning standpoint. So who's going to help make those decisions for you, or who are you going to trust to be able to do that? And then from a health standpoint, what is your goal? Like, how healthy do you plan to be? I see a lot of families or a lot of people think that everything is going to be fine and they're going to have all kinds of time to make decisions, but in a lot of circumstances, people's health decline really fast. So being able to discuss those is important. Probably one of the more sensitive topics is the driving. So when is an appropriate time for yourself, if you're giving advice to your own friends at a certain point in your life, like when is it time to take the keys away from somebody? And that's a really hard scenario for people to be in, because it's from the time that we're very young, 16 years old, or sometimes younger for some of these individuals, that's such a signal or sign of independence, and having that stripped away is a huge loss. And then end of life, sometimes people are trying to figure out how they want to age and what end of life looks like, but being able to talk about is, do I want to keep fighting this until the end and possibly die in a hospital, or do I want to avoid going through the rigor of going to appointment after appointment and being in the hospital, coming home, going to the hospital, coming home? Or do I want to select hospice care and be able to not pursue any curative treatments and just find a way to be comfortable at home and maintain as high of a quality of life as I possibly can without feeling like I'm a specimen going through the hospital system? So those would be things that I would encourage adult children and parents to talk very freely about. I know it can be difficult. I know it can be uncomfortable to do, but I've just seen so many families go through go through all of these issues, and they didn't talk about it, and now it's on the family member to determine what their mom or dad actually wants, and that's a really hard place for an adult child to be.